fever, fatigue, spot. Babe, I have monkeypox.
You don't have monkeypox.
Monkeypox.
Are you a WebMD?
No. I really want a banana.
Banana? What? What?
Banana?
Why?
Are you just hungry?
I'm hungry.
Get off the internet. We'll get you some food. You don't have monkeypox.
Hello and welcome back. Forward certified internist, Dr. Dre here. Okay, so you're convinced you have monkeypox. All right, you did your Googles, you refreshed that WebMD page about 6 times. You put all your symptoms in, okay, fever, fatigue, and you have 2 little pimple things there. All right, diagnosis, monkeypox. For sure. So all you need to do now is go to your doctor, rustle his prescription pad away, and you write yourself some of that medication you saw on the news yesterday. Right? Simple. Okay, not that simple, but you don't know how often this happens when people come in and they think they know the diagnosis. All right, so how does monkeypox actually present? Okay, yes, high fever, fatigue, enlarged lymph nodes, but in medicine, these are what we call non-specific symptoms. What that means is it doesn't really tell anything. It doesn't tell the doctor what this is or what it is not. Because off the top of my head, I can think of several other illnesses that present like this. Mono can present like this, bacterial infections, other viral infections can present like this. So you can't go crazy with these symptoms and just think monkeypox. Okay, so let's ask a few more questions. How does somebody get monkeypox? All right, so you're hanging around the zoo, you pet the monkey, and boom, monkeypox, right? Well, that's not how it's usually done, and it's unlike as the monkey in your local zoo gave you monkeypox. Well, again, so this is spread by close contact with a person who is infected or an animal that is infected. And it's done by touch, but it could also be respiratory droplets. But again, you do have to be in close contact with somebody who has monkeypox. And again, the original symptoms are non-specific, so you wouldn't necessarily know that somebody had it unless maybe the person had a rash. So let's talk about rashes. Okay, you got a rash. Definitely have monkeypox, right? Okay, don't start freaking out yet because there's several things that show up with a rash. Chickenpox has a rash, herpes has a rash, and yes, monkeypox does have a rash. So maybe you can differentiate all these rashes because they're not all the same. Everything that has a rash is not monkeypox. Monkeypox rash starts as flat, red lesions, and as they continue to go, they get a little bit bigger. They typically are fluid filled. They start to crust all over. So that helps us differentiate that maybe this is monkeypox. However, chickenpox also has similar looking lesions. They're very similar. The only difference is that this rash, the spots or the rash comes in different maturities. So you have some old looking spots, you'll have some new looking spots, where generally in monkeypox, they all kind of mature at the same time. However, is that enough to make a diagnosis? Would you look at yourself and say, oh, well, I have some old and some new. This is definitely not monkeypox, so I don't need to go to the doctor. Honestly, if you develop a rash, definitely get in contact with your doctor, talk to them, let them know your symptoms, let them examine you, and that would be the best way to determine if you possibly have monkeypox or not. Okay, so let's say you have the rash, that's away, now you're under treatment, right? So, you think you have monkeypox, I just need the treatment and I'm good. Add all to cart, send, I'm gonna take all the medication. Also, not a way to treat monkeypox. So most of the symptoms in monkeypox, mostly how it's treated, is called self-limiting. So what that means is the symptoms kind of go away by itself. Usually people are watched, they're observed. We treat the symptoms as they come up. So if you have a fever, we give you medication for fever. You have pain, we give you pain medication. But most people are not getting medications for monkeypox. There are 2 medications that are approved by the FDA, but those are controlled by your local board of health. So they would have to determine if it was appropriate to use. The next thing is there is a vaccine also. Vaccine is not handed out that easily. It's usually reserved for healthcare workers. It is also reserved for patients who are immunocompromised. So that would be the only ways to get the vaccine. Bonus tip though, those who were vaccinated for smallpox do have a little bit more protection than the general population. This is because smallpox and monkeypox are similar. And so if you were born before 1972, you likely were vaccinated and you likely have a little bit more protection than everybody else. So what is this all about? Well, what I'm trying to get across is you can't just jump to symptoms. I think if you suspect you were infected, you suspect that you are showing symptoms, the best thing to do is to contact your local PCP, go to the hospital, get checked out, let a doctor diagnose you, and from there, figure out if you do or do not. But I would like to say that monkeypox is extremely rare. Not a lot of people get it. But again, it is possible to be in contact with somebody. So the default is to be definitely checked out by a physician or a healthcare worker. And that's the best way. So if you like this video, please like and subscribe. And until the next one, everybody stay safe. Thanks.